Hi, my name is Shelley Swapp, and I am a clinical herbalist. I get asked quite often about my background and my training and why I became a clinical herbalist or how I became a clinical herbalist. And so I thought I would put something a little more formal together. I do have a degree from the University of Utah in mass communications and public relations. I worked for a number of years in those fields, almost exclusively in healthcare and special populations, working with underserved populations. And I spent a great deal of time working with the CDC and the YMCA in their diabetes prevention program. But I have used herbs and nutrition in my own home for almost 20 years to help our children as they have struggled with some pretty intense um, health issues that were not really well addressed by Western medication. It was after a number of years of using these things and having people come to me and always searching for more ways to help our family that I decided to go back to school. So I applied and was accepted at the East West School Planetary Herbology program, and I completed their 3-year clinical herbology program. I've also attended and studied with the Human Path with an amazing midwife named Katia Limon. I've done a lot of studies in herbal healthcare for specifically women through their childbearing year and throughout their lives with Katia. I've also studied and done some intensive programs in pediatrics with some amazing Chinese medicine and Western medicine doctors who utilize herbs and traditional therapies to help their clients. And I got the privilege to spend some time at the traditional Chinese medicine hospital in Shanghai, China, studying underneath some amazing herbal medicine doctors there who worked side by side with Western medicine doctors in cardiology and rheumatology, oncology, in a variety of different fields, and seeing how they utilized herbal medicine to improve outcomes at the hospitals there in Shanghai, China. I learned a tremendous amount from them. I also got to spend a couple of years and was a founding member of the East West Free Clinic in Santa Cruz, California. I worked side by side with some amazing Oriental medicine doctors and herbalists, acupuncturists, and other healthcare professionals in the low income and no income populations. We worked in the homeless shelters, in the mental health community centers, and with the veterans populations, in giving them access to this kind of care and seeing some amazing outcomes by utilizing both natural medicine natural herbal health care alongside other modalities to improve their well-being and their quality of life. So I bring all of that to the table when you come to meet with me and begin your journey in herbalism. Quite frankly, my training is never, ever over. I am always taking more classes. I am always studying and researching and learning, quite frankly, because every single case I see is different and every individual is unique. And so it usually pushes me to learn something new, to reach out, to take more training, to reach out to others, and I really love that about this field and about this job, because there is, like many of my mentors have said, that you'll never be a master because there's never ever an end to learning in this field. But we do get better, and we have a lot to offer, and I hope that answers your questions. And if you've got some more questions, you can always schedule a 15-minute consultation or meeting with me where we can talk more about what I have and how I've trained, what I'm trained in, and how I can help to meet your concerns and help you with your healthcare needs. Thanks. Bye-bye.